Hi, welcome back to our YouTube channel. I'm Jenny Hobbs. I'm joined here today by Dania Ermintrout and Alexandra Fabreo. We are going to talk today about um, the different paths for a parent to become a paid caregiver. So I wanted to walk you through how to find us on our website. We've got fragilekidsinc.org. This is our homepage. If you click right here where it says waiver and Medicaid services, you'll have a little drop down, and then we got Cap C. And then we're just going to slide on down here to parents as paid caregivers, step-by-step diagram. So we'll click on that. So we have three different diagrams because, as you may know, Cap C has three different levels of care. So you have CNA, which is defined by needing assistance with at least 2 ADLs. P&A is you need assistance with at least 2 ADLs, but one of them is a little bit higher level, like maybe oxygen or an IV, something like that. And then we have nurse level of care. So we're going to walk through these step by step. So we'll just go in order. We'll start with the CNA diagram. So hopefully you guys can see, can the two of you see these words well, or you need me to blow it up?
Maybe blow it up a little bit.
All right, is that better?
Yeah.
Okay, so if your child is CNA level of care and you're interested in being the paid caregiver, the very first question we're going to ask here is, are one of the 5 extraordinary circumstances met? So the extraordinary circumstances are listed down here. We've had a video series on those, so I'm not going to go into that today. But depending on what your answer is, that's going to tell us which bubble we're going to go to next. So if one of the 5 extraordinary circumstances is met, then we're going to come over here to the left. Hey. And the next question is, do you have an active CNA license? If the answer is yes, then you can come down here to the bottom where it says be employed by an agency. Also, if your answer is yes, you can also come here to the middle. It says, can you meet all of these? Can you pass a background check? Can you pass a competency evaluation? Are you at least 18? And are you CPR certified or a waiver obtained? That's typically, the waiver is typically for kids who are in hospice. Also, if you do not have an active CNA license, we're going to come to that same middle. So it's a little bit confusing. If you do have a license, this is an option to be employed by an agency, but it doesn't mean you don't have the option of going another route as well. So that's why yes is also here to the middle. So if you can meet all of those, then you can be hired through consumer direction. And so that would mean you would need an employer of record to manage your timesheets and payroll. You'd use a financial manager to help all of that. That is what people are typically calling CDEC right now. So that's how you get there. If you cannot meet all 4 of those things, then we're here at the stop sign and you cannot be a paid caregiver. So coming back up to the top, if one of the 5 extraordinary circumstances is not met, then the next question is, can you meet all of these, which are the same ones we just talked about? Pass a background check, pass a competency evaluation. Are you living with the child? So that's the difference. And then be CPR certified. If you cannot do those, then again, you're having to stop and you cannot be the paid caregiver. But if you can, then coordinated caregiving is your option to be paid. So that would be working with an agency that does coordinated caregiving. That is a monthly stipend, and you also receive like monthly training through that agency. So those are the complicated, convoluted pathways for a parent to be paid when the child is CNA level. Do you guys have any questions about this one?
Yes.
Yes.
Go ahead, Dania.
Okay, I just wanted to jump in and make sure we're clear on the be at least 18, because if it's relevant for you, you may have noticed that there is no age restriction on coordinated caregiving. And so I just thought it might be a good time for Jenny to elaborate on that, because we do have teen parents who have medically fragile children. And so this would be, if you are a teen parent, this would be the area that would apply to you.
Exactly. I don't know what else I can add to that, but yes, agree. That is the difference is because there are parents that are younger than 18, and so they do still have an option, a way to get paid through coordinated caregiving. And then when they turn 18, if they want to switch, and they're able to switch, that's a possibility as well.
And then just to be clear, when Jenny mentioned CDEC, that is Consumer Directed Extraordinary Circumstances. That was the acronym that is being used a lot frequently now and often gets confusing with a lot of families. What is CD? What is EC? And then CC is what is being used for coordinated caregiving. And Dania, you mentioned that there's under coordinated caregiving, there isn't a requirement for 18. So you covered that. So that is something that a lot of parents do not know about. So thank you for bringing that up.
No problem. And I appreciate that you explained the lingo that's being used now. And I think it's also probably helpful for anyone who's been in the program for a while, if you've heard the name CD Light or parent as paid caregiver, paid parenting, this is what we're talking about. But CD Light was the original name for CDEC. And after the pandemic, when we transitioned to the new permanent program after the end of the public health emergency order, that's when the name transitioned to extraordinary circumstances.
And just very quickly, before we move on to the next level, just to clarify that even though here it's got parent as paid caregiver, it is anyone who is a minor or someone who's over 18 that requires a legal guardian. So as a minor, you might not necessarily be the biological parent, but if you are categorically that minor's legal guardian, then that is what we are meaning by parent as paid caregiver.
Yeah.
If I come there
So,
nothing's done,
Um,
my food will be much less pleasant.
Yeah, in this context, I'm considering that the child is a minor. But if the child turns 18, if they're able to make their own decisions, then they can decide who they want to be their caregiver, and you don't have to go through extraordinary circumstances. That's if they still have the legal authority to make their own decisions. If someone has guardianship over them, then the extraordinary circumstances does have to be met because it's still kind of this dynamic. So it's just a way of protecting the children and make sure that they're not being what's the word?
Taken advantage of, potentially.
Exploited was what I was thinking.
Exploited. Yeah. And so I think that is also another great distinction is when the child is over 18, this still applies if the child over 18 requires a legal guardian, court appointed.
Yeah.
Could we talk a little bit more about the living circumstances? Because it looks like the consumer direction does not have that as one of the listed criteria. And I haven't thought about that directly until now, but I know there are a lot of complicated living circumstances in many families. Some children may have more than one household. And so is that part of a allowing for parents who are not the primary, don't have the primary home to be the paid caregiver, or does that speak to a different circumstance, Jenny?
That can definitely be complicated. It would have to depend on if the parents have joint custody, like 50-50, then they need to make a decision on if one of them was to do this, assuming that the circumstances are met. They probably can split it based on their time with the child, but they cannot both get 40 hours a week, even if they're living in two different houses. So, yeah, I feel like there's so many different scenarios that could come up with that. So if the parents don't have joint custody, then the one that has primary is the one that gets to decide how it works. So
Okay. Can you think of any other circumstances where the like why the live with child criteria does not apply in this circumstance?
not really.
Okay. I figured that that was the reasoning behind it. But
So as
just
far as we know, you have to be living in the home with the child to be paid to care for the child, whether it's consumer direct or coordinate, well, definitely coordinated caregiving, I would imagine, because coordinated caregiving, you have to be available 24/7.
mhm.
Well,
Yeah.
yeah, that's what she was saying though, is coordinated caregiving has the requirement of living with the child, and CDEC does not have that requirement. So, but it may be because, they live with one parent, but the other is providing the care. So,
So
Yeah.
we know for sure that if it was coordinated caregiving, it would have to be the primary caregiver where the child lives primarily.
yes.
Both parents could not under consumer direct. It gets a little bit more flexible or more of a gray
Yeah, well,
area.
and because it's hours, yeah, it's based on the number of hours that you work, whereas the coordinated caregiving, it really can only be under one household because you're assuming all that care. So,
Yeah. That makes sense. Like I think that clears it up. Um,
And so parents could not be paid, they both could not be paid more than the number of hours that the child has been approved for. So that was my question. So when you said they both parents could not be paid 40 hours a week, is that because that would exceed the total number of approved hours that the child would be allowed and approved for, authorized, or because you can't have both parents being paid 40 hours a week?
well, someone could be approved for more than 40 hours, but then the parent could only work the 40 hours. And if there was a second parent that wanted to work for children under 18, my understanding is that that is not supposed to happen. Now, I have talked with the state about when a child is 18, then they both can actually be paid if they have the hours for it. So not everyone's going to be approved for 80 hours or, more. Um,
That's,
especially a lot of the aid level kids.
yeah.
It, the aid level of care tend to have less hours per week than nurse level. So,
That's great. That was a question that often comes up under Consumer Direct. So if one parent got paid 40 hours and a child had been approved for 56 hours, could the other parent work the remaining 16 hours, even if they were living in the same house or even if they were divorced or separated, whatever, and living in separate homes? So that is a great clarification that as a minor, as a child, no. But after 18, if there are hours that the child is approved for beyond 40, another parent who is also a caregiver would be able to possibly be approved to be paid to provide those hours. Okay.
Yeah, I know of several circumstances where that has been the case, so feel pretty good about that answer, yeah. All right, should we go on to the next one?
Let's do it.
Yeah.
All right. The P&A. It's going to look very similar because it is actually identical except for the license requirements. So if the child is P&A, then if you want to be employed by an agency, you do have to have an active CNA 1+4 or a P&A license. Otherwise, all of the rest of this stuff to the right is the same. Background check, competency, living with the child, CPR for coordinated caregiving, and then the things in the middle for consumer directed. So these kids are a little bit higher level of care, but they don't reach the level of nursing. So the pay is higher to reflect that, but otherwise the setup is the same. So any questions about this one? It'll be short and sweet, probably.
No, other than there would be a slightly higher pay rate than CNA 1.
Yeah. So, all right, well then let's go to the last one because there's a lot there.
Oh, I'm looking forward to this one.
I have to give my husband some credit for helping me learn how to make these diagrams because I knew what I wanted it to look like and I drew it out on paper and he was like, this is the best way to do it. So I know it's a little bit confusing, but we're gonna get there. All right, so we're gonna start at the top. This is when the child is nurse level. So we're not talking about the parent yet, we're just talking about the child. So, first off, are one of the 5 extraordinary circumstances met? Again, they're down here at the bottom. They're the same as for the others. If the answer is yes, then we're going to come down here to the left. And it asks, do you have an active RN or LPN license and meet the criteria listed below? So that criteria down here is a minimum of 1,000 hours of experience in the last 2 years in an acute care hospital, a minimum of 2,000 hours of experience in the previous 3 years in an acute care hospital, a minimum of 2,000 hours of experience in the last 5 years working for a home health agency, or a minimum of 2,000 hours in the last 5 years in an area not listed above. That, in the opinion of DHHS, would demonstrate appropriate knowledge, skill, and ability in caring for the individual. So that's the additional requirements for this. So if you do have an active license and you meet that criteria below, if you're answering yes, we're going straight down. Then we're asking, do you want to self-direct your nursing hours? So doing consumer direction, self-direct is another way to say that. If you do, then you're down here on the bottom left, attendant nurse care. If you are an LPN, you will need to hire an RN to provide supervision because LPNs cannot work independently. But you can do that within the attendant nurse care bubble, let's say. If you do not want to self-direct your nursing hours, you can be hired by a nursing agency. And ignore the coming soon. It's already available. I just haven't updated the picture. So that's a second way you can work through a nursing agency. Okay, so coming back up to the top, and we're down here to the left again. Do you have an active or an LPN license? If you do not, have you engaged a home health agency to staff your child's PDN hours? If you have, we're coming down here to the middle. Are all of your hours staffed under PDN, excuse me, private duty nursing? If they are not, then it asks these 3 questions. Can you pass a background check? Can you pass a competency evaluation? And are you CPR certified? So if the answer is yes, then you can move up to 40 hours per week, whatever the deficit is between what you're trying to get staffed or what you have staffed versus what you're approved for. So you can move up to 40 hours per week down to CNA level of care and do those hours through consumer direction. If you can't meet those, then we're at a dead end. We have to stop. Coming back over here to, are all of your hours staffed under PDN? First of all, jealous. Um, so if the answer is yes, then we're back to these 3 questions or 4 questions. I'm sorry. Can you meet all of these? Pass the background check, pass the competency evaluation. Are you living with the child, and are you CPR or BLS certified, or have a waiver? So if you cannot do that, then you have to stop. You cannot do it. If you can, then we're here at coordinated caregiving. So we ended in 4, well, 5 if you count the stop sign, 4 very different setups. So we've got from the left side, the attendant nurse care, which is consumer direction for nursing. We've got it where you can work through a nursing agency and they can hire you for the 40 hours and then hire additional hours on top of that. You can move 40 hours if you're not a nurse to P&A and do the work through consumer direction like we just went through on the previous pages, or you can do coordinated caregiving. All right, what questions? I know Alexandra has a bunch.
I do. So a lot of questions that keep coming up, and one in particular is, how are you able to qualify for coordinated caregiving if all your PDN hours are being staffed? If it is not paid in 15-minute increments, your PDN, and coordinated caregiving is a stipend, a monthly stipend. Is that not a duplication of services? So having spoken with the various agencies that are providing coordinated caregiving through their agency, they've been saying, with the exception of respite hours, PDN hours are a duplication of services.
So you're asking me if that's accurate. That is so tricky. And I feel like I've asked them this question and I don't remember the answer. So I can make myself a note and we can come back to that another day. I'll try to post an update maybe on underneath the video when I get it. So it's PDN hours plus coordinated caregiving.
Right. So the question keeps coming up is, if I don't have, I'll go to the next question afterwards. First question is, if all my hours are staffed under PDN, how am I able to qualify for coordinated caregiving for my child because of the duplication of services, with the exception of respite? So it appears as though the agencies that are providing coordinated caregiving are saying that you can get respite and it's not considered a duplication of services. I don't know how you document that to show that. So that becomes a bit tricky. But also, how do you get to be qualified for coordinated caregiving if all your hours are staffed under PDN? That's one question. The second question is...
Can I answer that?
Yes.
Yes. In terms of respite, I don't know about the PDN hours, but in terms of respite, if it's a duplication of service, yes, it's a monthly stipend, but it's a daily rate. So they might just be docking the daily rate for whatever days you received respite. So even if that's true that you can't use them there is a way to not use them at the same time. So that would be my guess, and probably for PDN as well. Although I know nobody wants to hear this, but my guess is, I don't know who just pulled in my driveway. My guess is that they would say, well, if all of your hours are staffed, why do you need coordinated caregiving? because this is about finding alternate ways of staffing when it can't be met the normal way. So
Right.
that
Exactly.
that may very well be the answer, is that you can't, you're not supposed to, because this is supposed to help fill in the gaps. And it kind of goes back to, I know I included that in like the last post that I put on Facebook from my meeting with Rena and Michelle, but this stipend thing, like any income, I mean, I guess you would still call it income, any money earned as a parent is not meant to be a salary or something that is like a forever thing. They don't want you depending on it. And so I would think this is one where you would not get it if you have all your hours staffed.
Right. So that was my question, because if it is duplication of service and you're getting 112 hours a week, fully staffed, then what are in the child's best interest to be able to justify being paid as a parent under coordinated caregiving? Okay. The next question that I had, well, there's also the one about the respite, which was, thank you for explaining that with coordinated caregiving and how the respite would be documented. But the next two questions are under PDN, if not all of your hours are staffed and you are trying to get nurses, or you don't have any nurses, or we have some nurses, or if you qualify for EC extraordinary circumstance number 4, which is only you can provide care to your child, what is the justification for not being told, well, then you qualify for coordinated caregiving because you've got no nurses in the home, or you aren't going to have any nurses in the home because only you can provide care to your child because it's under EC number 4. So when do you get, because a lot of parents are saying, but I want extraordinary circumstances, I want to be able to be paid under consumer direct, but coordinated caregiving technically is an option because I don't have any nurses in the home, even though I'm looking for nurses, or I've been approved under extraordinary circumstance number 4, but then no one else can. So why
But you
would
still can use respite. So, and if you're approved for extraordinary circumstances number 4, then obviously you're going to use consumer direction and not the coordinated caregiving. But if the concern is, if I choose that and I'm saying that no one else can provide care for my kid, how do I get a break? Because that is super important. And I know that there's been a lot of talk about, well, you don't get one. You're the only one that can provide care. And I clarified this several times with Medicaid to be, 1,000% sure in this answer. And they're talking about, can you have, are you the only one that can provide the consistent regular care that your child needs? But they all 1,000% are behind families using respite and how important that is. Even when CD Light started, I remember having conversations with them, and I know how important respite was to them. So there was even a requirement that it had to be used quarterly. I don't know that that is still the case. But respite is super important, and you are allowed to use it even if you use EC number 4.
Okay, great. So just because you're the only one who can provide care to your child does not negate you from accessing your respite hours. Okay. So that is where I come down to my last question. Is it categorically correct, because this is where a lot of families are getting pushback from CAPC CAP case managers or agencies, that if you qualify for one of the 5 extraordinary circumstances, they cannot force you to do coordinated caregiving?
Correct.
Thank you. Okay. That's something that I want to make sure all families are clear on, that, especially when communicating with case managers, because a lot of the time that is not clear.
Yeah, it's not really a choice. And I mean, that's part of the conversation I had with them last week or whenever it was, 2 weeks ago. you're not choosing one or the other. It's what are you eligible for? You're really only eligible for one or the other. And so, yeah, if an extraordinary circumstance is met, then that's where you go. Yeah.
That's a great way of wording it, Jenny. It's what you eligible for. It's not a matter of a choice. I think that that would be very helpful for families to have that wording.
Yeah. All right, what else you got?
I think that's pretty much my questions in this category that are the main questions that keep coming back to me from parents, especially with skilled level kids. But I do want to go back to PNA level just to make a one quick mention, because this is something that I forgot that some parents have asked me. Even if a parent or a legal guardian is a nurse, LPN or RN, if your child qualifies for only PNA level of care, you won't get paid according to your qualification, but you are paid according to your child's level of care by the state's assessment.
Yes.
Correct.
Yeah, the approved rate is based on the child's level of care, has nothing to do with parent qualification. So, yep.
And one thing to add to that, actually, for families that, your child is in a particular level of care now, we call it LOC or level of care, but different circumstances related to their diagnosis or their can occur. I mean, things can improve, conditions can worsen over time. There can be an event that creates a new health condition. And in those moments, or over that period of time, if there is a change, your case management agency is responsible for keeping up with that and doing what's called a COS, or a change of status, to ensure that your child continues to be at the level of care that's appropriate for them. And sometimes, in my experience, there have definitely been children that I've encountered that are not at an appropriate level of care after a transfer, or, cases that I've provided consultation on in the community. And I've encouraged families to make sure that they are really familiar with what constitutes each level of care, so that you know that, number one, that your child is receiving the most appropriate services for what they need, but also because it's so difficult to staff. And if you are supposed to be at a higher level of care, if your child is supposed to be receiving a higher level of care, as you move up the levels of care, there's a pay increase. And so then that would be easier to attract caregivers for more complex tasks that the caregiver would have to do on behalf of your child. So that's really important to keep up with and make sure that the tasks that are involved in your child's care continue to be communicated to your case manager, and any change in circumstance, like you add a G-tube, you lose a G-tube, the requirements of like PRN oxygen then become a prescription for titrated oxygen, where it needs to be changed. The level of the oxygen needs to be changed because the child's oxygen saturation is fluctuating a lot more than it used to. So those are all things that are really important to keep track of, because they really have direct relationship to this whole consumer direction process. I'm trying to think of anything else. I know some questions have come up about coordinated caregiving and the differences between coordinated caregiving and consumer direction. And I'm not sure if we're going to do that in a different video, or if we want to.
We probably will go into more detail in a different video, but we can touch on it real quick.
Yeah.
Do you
Yeah.
want me
Yeah, you want to go ahead and do that?
Okay. So consumer direction, there are a few key pieces that are important to keep in mind. And one is that there needs to be an employer of record, and that cannot be the person that's providing the care. So even if you are the parent, and the child's under 18 or they're over 18 and you're their legal guardian, you cannot be the employer of record. So you would need to find someone else. It can be a spouse, a friend, a family member. They don't have to live in your house. They don't even have to live in North Carolina, but they have to be willing to assist with some ongoing paperwork, so that it would include working with your financial management agency to ensure that payroll is done, that licenses are kept updated. If there's any issues, like the employer of record is who responsible for fixing it, not the parent. The employer of record is supposed to have contact with the case manager once a month. So it is a little bit of work for to ask somebody to do. So just keep that in mind. And if for some reason you cannot find anyone, you don't need that for coordinated caregiving. They have an agency that does all of that for you. So I think that would be like the main difference is if you're able to keep up with the paperwork, like keeping your employer of record like updated about, hey, you need to sign this, or hey, my case manager is asking for this, although it probably should come from the case manager and not you. But if you don't have anybody like that in your life, then coordinated caregiving might be the way to go. I will say, just as a word of warning, there are people, I don't know that I would call them agencies, but there are people that you can pay per document to sign off on stuff. I found this out when I was helping someone whose mom was in CAP-DA several years ago, and I'd never heard of such a thing. So keep in mind that your employer of record would need access to your social security number, your child's social security number, birthdays, like very private information that should probably not be given to some guy that you find on Nextdoor or something like that, that's willing to sign off on your stuff. Like, please don't do that. If you really have nobody, and you want some help thinking through that, you can certainly reach out to us and we can try to brainstorm and make sure there really is truly nobody in your life. But if there is not, then coordinated caregiving is always an option. I know that the pay is not as much, but even if it was something to do for a while until you found somebody that you could feel confident in sharing all that private information with, because that is really scary that people are doing that.
Yeah.
So yeah.
I know this issue is a tough one, and it comes up quite a bit. And I will say that choosing your employer of record is extremely a very, very important decision, and it's a serious decision. And I think that a lot needs to be considered, especially if you are in a relationship that is going through some difficulties, especially including potential family violence. If if you have someone who you don't completely trust, they may not be the best person to be in charge of this, because this person is capable of making it difficult for you to get paid for this job. So, choosing wisely is pretty critical, because if they don't respond, if they don't do the work, you won't get paid, your respite worker won't get paid, and the job is a volunteer position. So this would need to be someone that has a vested interest in your, you receiving economic support to care for your child, and a person that is diligent and follows through on things and is reliable. and as someone who isn't going to get bitter over time that you are getting paid and they are not. So these are really things to consider. And, you know, it may be awkward that I'm bringing up, you know, difficult spousal or partner relationships, but that's something that comes up more often than people, well, maybe you can realize that, but it comes up quite a bit. And so I would say that that's really something to consider. You don't have to have your spouse as your employer of record. It can be someone else. If your parent, if your sibling is available to do it, you can choose them. There's no reason why you have to choose your spouse. So just think about all of what this person's job duties will be and think about maybe who the best person in your life would be to do that. And whoever this person is can't be a respite provider. So let's say you want your parent, like let's say your mom, who you know, to be the employer of record, that person, your mom, then could not be a respite care provider for your child. If they're the employer of record, that is it. They provide no caregiving tasks that are paid. So there are a lot of things to take into consideration of what this person is giving up if they do have the potential to be kind of a you know, a potential caregiver. And some people, some grandparents may live far away, and that's really not an option most of the time, and it may not really matter. But if they do live nearby and being a paid caregiver is important, also something to take into consideration.
Yeah, thanks for bringing that up.
Trying to think if
Any
there's
other last minute parting thoughts?
I think my only other parting thought would be for those that are watching this, if you want to put in the comments, if you have additional questions, or if you want to reach out to us through Advocates for Medically Fragile Kids North Carolina on our website, through our email, that would be great. And we can use it in follow-up videos addressing these topics, and we'd be happy to answer them for other people. So this is kind of a comma in this topic, and because I'm sure there are a lot of different situations that are that you all may have that we have not thought about.
Yeah, that's a really, really good point, because every child and every circumstance and every situation is so unique and so different. So a lot of what we discuss is issues that come up more frequently and brought to our attention, but that doesn't mean that that's exhaustive. So anybody who has a particular situation that they want clarified or they're running into difficulty, to definitely put in the comment. Like Dania said, please put in the comment anything that you need and answered or further clarification, or to email through the website or join the Facebook group. And you can also DM or PM, whichever, direct message or private message through there. That's another way to contact everyone. But definitely comment on those issues. And then I do know that a lot of individuals have issues with LRI or paid parent or what is a legal guardian. And I know we were discussing earlier that we will be making another video, a separate video, to address that specifically. And then all the extraordinary circumstances, Jenny's gone over those in detail in a series of videos that are already uploaded. So please refer to those if you have any questions about extraordinary circumstances. And again, subscribe to our channel. That would be awesome to subscribe. And obviously, every time something new comes up, you will be notified. So that's incentive to subscribe and comment as much as you want. Let us know of other issues, perhaps, that you would like us to cover. And then you can navigate to our website, fragilekidsinc.org, and consider sharing with as many as you know, and consider donating for our cause. And we would be going into that in more detail, what our donations are used for, so everybody knows what it's used for in another video. I think I remembered everything, Jenny and Dania.
I think we covered it all. And of course, it's never goodbye, but see you later, and we'll keep the discussion going. So thank you both for being here.
Thanks, everyone.
Bye.
Bye.
I can't find it. There it is.